And unfortunately, much of that care coordination, management of care, sometimes being the expert in your child's care if you have a rare disease, is really shifting to the family. And so we're trying to enact new models that are trying to shift it back and take some of that, alleviate some of that from the family. And we'll talk a little bit about that. So next slide, please, Karen. So I really, again, we're aiming for health equity, and Dr. Catherine spoke about sort of what the definition of health equity is, but it really is going beyond just the management of children's health care, but it's really ensuring that we have systems and supports in place to meet the complex needs so that families and children can have a full life and thrive. That is the aim, and that they can be successful in their communities. Unfortunately, some of the disparities that we talked about that we're seeing for families, and I won't go into too much of this because certainly the families can speak to this much more than I, but we're seeing many children and families are experiencing higher rates of stress, physical and mental health issues in their family, financial challenges and higher rates of poverty among this population. Oftentimes one parent is unable to work because of the care needs of their child. Challenges for sure accessing adequate services and support. That might be respite care, financial supports, in-home supports, or just supports that perhaps don't yet exist for some of these complex and unique needs. And certainly children with severe behavioral challenges are often excluded from existing services. So we're really seeing some gaps in access. That's resulting in what we're seeing as persistent unmet needs and poor overall health outcomes, not just for the child, but for the family as a whole. Thanks, Karen. Next slide. You've probably seen, diagrams like this, but just to sort of what we're talking about. So our systems, as we said, are typically designed for standardization. So it's sort of a equality, more focused systems. And so now we are, thank goodness, shifting towards more equity systems. And so as you'll see in the picture, equity is really around augmenting services just so that people are at a standard level and a similar level of care. And what we're aiming for in the long run is a larger solution, longer term solutions in our health systems, which is really removing the barriers that are leading to these health disparities and inequities, removing the fence. We're not there yet, but we are seeing many more equitable models of care to support children with complex needs. The next slide, please, Karen. So just to summarize some approaches to reducing these health disparities that we're both enacting at our hospital and into community, and many other centers are as well. Hospitals have complex care programming. These tend to focus on acute care, inpatient services, children with medical fragility that have long hospital stays, and really intensive wraparound supports aimed at stabilizing the child, but also really enacting plans to for successful discharge, successful transfer to community, and how those children will be supported to live successfully at home or in their communities. We are seeing now more of an expansion of this complex care programming to ambulatory, which I think is also really exciting. So once the child has been discharged and in community, how do we ensure that these children have supports? How do we ensure there's a bridging across services to community and to acute care, to schools? And that's where we see models like care coordination and navigator roles coming in, which have been really successful. And that's really sort of alleviating some of the pressures on families. It's helping them coordinate the care so that they no longer have to be the case managers. It's ensuring, sometimes it's the care coordinator is the one provider who has a full picture view of what's happening for this family. They understand the family context, the financial, is there housing concerns? Is the family experiencing cultural barriers or cultural practices that are not culturally safe? The family might have language barriers or literacy barriers. So it goes beyond just sort of scheduling and coordinating the care, but it's really understanding what's happening for this family, how much can they take on or not, and how do we work with them to get them set up. And so some of that is getting them set up with family supports, which we know are very disparate. Some of the application processes are very arduous. there's wait times. And so families need support, finding things like respite, in-home supports. Some families are having to be their own managers of staff in their homes and trying to hire staff and turnover. And so providing supports to families that are trying to manage that. Early childhood intervention, school-based resources, financial supports as well. So again, really getting families set up with longer-term community supports. And peer supports as well is really critical early on in diagnosis as much as we can to really link with other families, particularly for families with rare diseases, to learn from each other and have those supports across families and understanding some of the things that worked for them, and our care coordination can help that. And in some ways it's really, we're looking at providing care for families, and I like Dr. Catherine's, it's hard to reach, need to reach. Sometimes we find families are not able to follow through on recommendations. And this is sort of delving into understanding what's happening for the family. Why are they struggling to follow through? Is it just the sheer volume of disparate recommendations we've provided to this family? Do they not have transportation? They can't get to their home. Perhaps they haven't had someone, they've lost their in-home support to monitor their child overnight with their trach, and they haven't slept in 3 days. And then they come to an appointment 15 minutes early and we turn them away. So it's really trying to understand the circumstance for these families as we provide care. Thanks, Karen. Next slide. So this is my last slide. Again, I think what we're aiming for is that last slide on the equity diagram of removing the barriers for health equity. We're inching towards equity in the middle and working on system level. So achieving meaningful system level change where we actually see cross-ministerial collaboration and streamlined funding processes and service delivery for children with complex needs. And truly this will benefit all children. Families who experience holistic and coordinated care that meets their unique needs and has that flexibility built in, and a focus on quality of life and thriving for those children and families in their communities. So that's my overview, and I'm very excited to get to the rest of the presentation. I'm going to hand it over to Karen, who is going to introduce our wonderful family co-presenter, Francine.
Hello, I have the privilege of introducing a family that I have been working closely with over the past year. Today I have the mom here, Francine Bourget. She is a devoted mom of 3 amazing boys, and her journey as a parent took an unexpected turn when her twins were diagnosed with glucose transporter deficiency syndrome. In response, their family embraced a medical ketogenic diet, fostering a low-carb lifestyle to support the health needs of their boys. Alongside her, Francine finds joy in homeschooling her children, cherishing the opportunity to nurture their curiosity and growth. Her family's passion for the outdoors shines through as they embark on a quest to spend 1,000 hours outside this year, creating cherished memories amidst nature's embrace. So I'll turn it over to you, Francine.
Awesome. Well, hello. My name is Francine Bourget, and I'm honored to share my family's journey with you today. I have 3 boys, but today we are going to be talking about my twin boys, Silas and Kane, who were born with glucose transporter deficiency syndrome. Our lives have been profoundly shaped by the challenges and triumphs that we have faced together. From the moment Silas and Kane began experiencing seizures at 6 months old, our family's journey took an unexpected turn. Initially misdiagnosed with leukodystrophy, we were devastated by the prognosis that our boys might not live past their 4th birthday. Imagine the overwhelming flood of emotions when you're told your newborn twins won't live past the age of 4. The crushing weight of that prognosis threatened to drown us in despair. But then, amidst the darkness, came a glimmer of hope. A call informing us of a misdiagnosis. Our twins, Silas and Kane, didn't have leukodystrophy as initially feared. Instead, they had glucose transporter deficiency syndrome. We'll call it GLUT1, a rare metabolic condition that would shape our lives in ways we never imagined. I remember telling myself that I promised I will do anything and everything for them. I was not going to take this miracle for granted, and whatever I had to do for them, I was going to do it. sparking a newfound determination to advocate for my son's well-being. We started talking about treatments and care for the boys. My boys had uncontrolled seizures. Initially, we were told the boys had to fail 4 medications before starting a medical ketogenic diet. Sounds strange, doesn't it? I knew I had to do more research. I found that medications had a 25% success rate at controlling seizures, and the medical ketogenic diet had a 75% success rate. When I presented this information, I was told that it would be too hard to do a medical ketogenic diet for my twins. It would be easier to give them medication. We were given medication to try and we were sent home. My intuition was telling me that this was wrong. The medication was so difficult to give my babies multiple times a day, and it had a very strong, horrible smell. The fact that it wasn't working made it harder to accept. I just had to find a better solution. Picture the sleepless nights spent researching treatments and the heart-wrenching sight of our precious boys enduring seizures. Each day felt like navigating through dense fog, desperately searching for a ray of light to guide us. I vividly remember the day we were able to start a medical ketogenic diet for Silas and Kane. It was like stepping into the unknown, armed with only the determination of a mother's fierce love. Squaring off against the skepticism from medical professionals, I refused to accept the defeat. The moment we saw those seizures cease, replaced by the peaceful stillness of a seizure-free day, was a victory worth every tear shed and every obstacle overcome. Yes, the medical ketogenic diet is hard, but watching your child seize is even harder. Over the years, every concern I would have, every worry I would bring to light was always met with smiles and the good old question, have you joined any Facebook groups for GLUT1? What do other GLUT1 moms suggest? Do any other kids with GLUT1 present with these symptoms? I didn't find these questions very helpful. It was frustrating. I started getting tired of dragging my boys to these appointments just to be told to ask my Facebook groups and get advice from other moms going through the same thing. We've faced countless roadblocks and setbacks along the way, from a lack of support and feeling brushed off with empty reassurances of being a super mom. Now, calling me a super mom is basically the ultimate guilt trip, because superheroes are able to save everyone and do it successfully and gracefully, and I am not doing that. My boys are struggling, and I'm afraid, with tears in my eyes and cracks in my voice, because my boys are having a really hard time with their symptoms. I'm not a superhero, and I'm desperately seeking guidance and expertise. Despite our best efforts, there have been moments of frustration and uncertainty as we've sought to navigate the complexities of managing GLUT1. From feeling the need to take the lead in advocating for our children's care, to grappling with the financial burdens of a medical ketogenic diet, attending conferences outside of Canada, and seeking out specialized treatments, every decision we make is driven by our unwavering commitment for our sons. It's hard to find confidence in my care team when they say things like, "You're the GLUT1 expert, you know more than we do." In 2019, I saw that there was going to be a GLUT1 conference where all the experts were going to be to share and learn with each other in Washington, D.C. I knew I had to be there to help my boys. Silas and Kane were 2 years old at the time, and I went to the conference alone. Can you imagine the fear that was pulsating through me leaving my 2 fragile little boys? It was awful, but I knew I had to do this to help them. At the conference, I received more information that I knew what to do with. One big thing that was highlighted over the 3-day conference was the importance of having a supportive medical team that worked together and had open communication to provide support and collaborative care planning to meet needs of my children. I finally felt hope. I was so excited to bring this information back to my team so I could help my boys. When I told my team this and asked for a team meeting to include everyone involved in my son's care, they had a little chuckle and they told me that that's not how the system works. I felt crushed. I knew how important it was for my child's care team to come together. So of course I advocated and begged and pleaded for my team to get together so we can all collaborate and talk about this information. Finally, we came together as a team. I really thought that if we brought everybody together, they would embrace working together this way and that it would be easier for them. But unfortunately, this meeting did not go as I had planned. The journey of navigating a rare medical condition has transformed our family's dynamics in ways we have never anticipated. From homeschooling our children to ensure they have access to therapy and personalized learning, to dedicating countless hours to researching treatments and educating ourselves about GLUT1, to weighing and measuring every morsel of food they eat to equal a 3.25 to 1 ratio, every aspect of our lives has been touched by this journey. So, today, I am reminded of the importance of collaboration and support in the journey of raising children with complex medical needs. While the road may be challenging at times, it's the love and resilience of families like ours that truly make a difference. I'm hoping that one day we can get to a place where compassionate care is not just a buzzword, and it is not so difficult to have coordinated, collaborative care, as that is truly the guiding principle that lights the path towards healing and hope. Thank you.
Wow, thank you very much, Francine, for sharing your story with me. I, of course, knew bits and pieces of your story, but I haven't heard it in those words, and that was really powerful. I hope that we can leverage stories like Francine's to build momentum for change. And I think hearing her story today is a reminder to all of us how important and valuable it is to have families' voice at the table when we're making decisions about how to support children with complexities. So one of the challenges that I find with disparities, I'm going to explain in a personal story. I have a son with a significant neurodevelopmental disorder and comorbid conditions as well. And I remember when I was picking him up from school, when he was in elementary school, waiting outside the door with all the other parents eager to see your child run out to you. Him coming out the door, and instantly I knew things weren't going to go well. I could tell by the look on his face. He ran up towards me, screaming, crying, throwing himself down on the ground and throwing his backpack at my feet. And in that moment, I would have done anything to just disappear. I was embarrassed. I knew that other families were looking and judging his behavior. And I knew that they were also judging how I was going to handle it. In that moment, I wished I had a sign, something that I could hold up to explain that the way my son's brain works is different than the other children's. And as a result, the way that he reacts sometimes is completely out of his control. So that's the thing about disparities. They're not easily recognized because there's no sign attached to them. Within my role as a care coordinator, I begin with a needs assessment. I listen to my family's story, resilience they have, and how being a parent is not what they imagined it would be. This is the beginning of our partnership. Dr. Jody Carrington is a psychologist here in Alberta, and she often uses the phrase, empathy lies in the space before judgment. Understanding where our families are coming from evokes empathy and an opportunity to pause before we form judgment. And these are the stories that we can bring forward to other providers and members of the community that are supporting the family and the child so that they better understand where that child is coming from. Very recently, I attended a case conference at a school. We had several members sitting around the table that were involved in this child's learning. The mother was there as well, alongside me. And the reason for our meeting that day was because the school team was having a difficult time understanding how this child's medical conditions and medication side effects were impacting him in his learning environment. And the mother was getting a lot of negative feedback around his behavior in the classroom setting. And that was really hard for her to hear. So at this meeting, we presented a new picture of this little boy and all his strengths and the gifts that he brings, all the things that he's working very hard at, and why his brain works differently and how those medication side effects impact him. That meeting was incredible. And by the end of it, we had people all around the table asking us questions and pausing, and I could tell that they suddenly saw this child in a completely different way. Just yesterday, I received an email from an allied health staff who provides support in this classroom at times, and she had gone in to see this child and sent an email to the mother and myself to let us know that there has been a complete change for him in the classroom, that the way that he's interacting with the teachers is different, and her ability to interact with him and motivate him to do some things that day was also different, just due to his energy and how he was feeling about himself. And the mother also made a comment that he's coming home happy for the first time this year. Oh, my apologies, I forgot to forward my slides there, I see. So within healthcare, we talk a lot about standardization and universal care. Whenever I hear those words, I struggle a little bit, because the population that I serve that just doesn't work for. And so I kind of delved in a little bit to those words and thought, what is it about standardized that we like and works for us? And I came to understand right here what it says around it just is a way that we can create efficiency sometimes. Often when we're talking about standardized care and treatment, we have a common language that we're all comfortable with and familiar with. We're also looking to achieve a specific outcome, often one that's measurable. And within healthcare, we like things we can measure. We like numbers to prove that something is effective. And it's also a way that we can establish a set of recommendations or treatment. So what does this mean when we're talking about equity within complex care? I'd like to give the example of treating a child with a diagnosis of ADHD. There are very clear Canadian ADHD practice guidelines. The way that we arrive at a diagnosis is the same, and the medications we use to treat ADHD are the same. However, for the population we're talking about today, there are often multiple conditions that must be taken into consideration, in addition to social challenges, when deciding on treatment for our population. By considering all of these things, we're able to customize their care, design a path that is unique to each family. Some of the things that are important to think about are just questions to ask families, their ability to attend appointments regularly so that they can have adjustments made to the medication. Well, can that happen in person? Could it happen virtually? Could some of those appointments happen over the phone? Do we give parents those options? What about the family having benefits to cover the medication that you've prescribed? Will they remember to take the medication if the parents have left in the morning for work before the child's even gotten out of the bed? How can we be creative about that? Could the medication be given at school? When barriers are addressed, we achieve the same outcome. We get to the same destination, but each family will get there along their own path. And to do that required customization, flexibility, and often quite a heavy dose of creativity. So, who does what? Families raising children with complex needs have extraordinary demands placed on them. Their brains are flooded with endless to-dos. These include things like communicating with multiple service providers, coordinating and attending appointments, responding to emails, paperwork. As Francine mentioned, she spends a great deal of time creating meals and food from scratch due to her boys being on a special diet. There's often multiple medications that need to be given to children at various times throughout the day, and lack of sleep for our population is huge, both for the child as well as the family. And what about the other siblings that could be within the home? Not only is the parent working hard to manage their child with complex needs and meet those needs, they also need to meet the needs of the siblings. And in addition, this population tends to have a fairly high frequency of challenges around emotional dysregulation, which causes a lot of behavioral challenges that can really be difficult in the home, community, and school settings. And worry. I cannot emphasize enough how heavy the worry is for our families. And this is something that never leaves their to-do list. It's constant. Because they are facing decisions about their child's care, because ultimately they get to make the final decision as the parent. And they are battling always with whether or not they've made the right decision, because their decision is going to ultimately impact their child's health and future. So that's when I often hear about decision-making fatigue from my families. And at this point, families simply cannot make another phone call, fill out another application form, or reach out for help. Families are constantly given recommendations or treatment plans, and the implementation and follow-through is up to them. And let's keep in mind that for these families that may have several, multiple or comorbid conditions, we're talking about recommendations and treatments that are coming from multiple providers. What inevitably gets in the way are the additional financial, psychological, and social stressors that these families face due to raising a child with complexities, and the conditions in which their children are born into, live, learn, play, and grow up. This is why I think it is so important to hear their story first and know and understand where they're coming from. If some of those to-dos were shared amongst providers, who can, who should, who does? Does the family leave your appointment with a clear plan? Do you take the time to review the recommendations and address who and how they will be able to get support to follow through on each one of those? Families' capacity to do these things themselves will wax and wane over the course of their journey and is influenced by the barriers that are unique to them. When you hear your colleagues tell you that you're helping too much, that you just need to stop hand-holding, I would challenge you to ask, when did holding someone's hand become a bad thing? The children's community is where their health and development happens. It can be fostered there, and ultimately we hope that that's where it can be sustained. I try to start by helping my families identify who their people are, the people that will become part of their team. And we can think of that very broadly so that we can create a big team for our families and think about the team that they have within their healthcare journey. But what about within their school setting, recreational activities that they might be part of, whether or not they're part of a faith-based organization, neighbors? Often these families have very frequent contact with their pharmacy or different support groups within the area. Together, we establish relationships with these people that are rooted in trust and respect. Recently, I reached out to a school for a family that is facing significant food insecurity issues because I wanted to inquire about whether or not there was a brown bag lunch program available at their school. And when I spoke with the principal to explain the situation, and I was grateful to find out that, yes, in fact, they did have a brown bag lunch program and she would get him on the list the next day. That conversation opened up a door. She had actually never met the mother in this family. She didn't understand all the challenges this family were facing. And suddenly she got really creative about other ways that the school could support this family. They have a food pantry that the family can come and access. They have access to winter clothes and winter coats and spring coats and whatever type of things like that the child, might need. And she also talked about bringing on other people within the education system that could support this family as well. So when we're looking at all these different kind of touch points that families have within their community, it's important to look at all of those people and identify what skills do each of these people bring to the team? How can they help? And who have we not reached out to? I think it's also important to sometimes get out of that habit we sometimes have around saying, well, that's not part of my role. And if each of us just took on a little extra piece, what a big difference that could make collectively. I recognize that as providers, we cannot do everything. Therefore, it's really essential that we share this work. Each member of the team has something different that they can offer. To me, that's what community is all about. Once a team is developed, families are less likely to feel isolated and start to recognize recognize that they do not have to walk this journey alone. We are privileged to walk alongside our families and have the responsibility to make equity a part of each step. When equity is a foundational element of your work, people around you see it, they hear it, and they will strive to do better. Health outcomes will also improve. No one is off the hook. It doesn't matter what your role is. Equity is everyone's work. Ask yourself, how can I show up and do better every day? I don't know about you, but I can't believe the number of usernames and passwords I need to keep track of. Before I can connect with my friends, respond to an email, complete an e-transfer, or start my workday, I need to input a password. Imagine if we couldn't do anything without equity being considered first. Equity being a compulsory step before starting our work, making it something that we had to acknowledge and ultimately find solutions for. I challenge you to think of equity as your password. Now I'd like to turn it over to Nadine, and she is going to introduce us to our next amazing parent here by the name of Marissa.
Thanks so much. And Karen and Francine, I just can't say enough about your impassioned presentations and the examples you provided that really brings to life, I think, what we're talking about here at Health Equity. And I just feel really, really fortunate to work with this group and to try to advance equity, reduce disparities for our families. So thank you so much. So I'm going to introduce, if we just move to the next slide, I have the great pleasure of introducing our next family co-presenter, Marissa Cowie. She is a mom of 2 young boys living in Airdrie, Alberta. Her journey into medical complexity began when her youngest son was born at just 25 weeks gestation. Their family has spent the past few years searching for an overarching genetic diagnosis to explain his evolving picture. Marissa's boys enjoy playing Lego, going on family adventures, and creating imaginary games together. They are very excited for the upcoming trip to Disneyland this summer. It's fantastic. So Marissa, welcome, and I will hand it over to you.
Well, good morning or good afternoon, everybody. Thank you so much for inviting me to share our family's experience on caring for a child with medical complexity. My name's Marissa. I'm a mom of 2 boys. They're 7 and 5 years old, and we live in Airdrie, Alberta, which is about 15 minutes north of Calgary. My husband and I moved here about 9 years ago, and we don't have any immediate family in the province. Our family's journey into medical complexity began just over 5 years ago when our youngest son, Miles, was born extremely premature at 25 weeks gestation. We found ourselves suddenly thrust into the world of the NICU and all that it entails. His first month of life was filled with challenges, setbacks, and fears, but the NICU he was at prioritized parent collaboration, which really made us feel like a valued part of the team. His nurses made every little milestone special. Our opinions were considered when treatment options were uncertain, and we really felt like he was getting the best care possible. Once he was extubated and starting to gain weight, we were moved to a lower level NICU in the city, which came with its own benefits and challenges. Miles had his own private room where I could stay as long as I wanted, and they even had meals available for free from a local charity. That was a lifesaver because we didn't really have time to prepare food to bring every day. At the time, the change from one-to-one nursing to slightly less support was very difficult, but it was a necessary step in getting ready to bring him home. After 82 days in the NICU, Miles came home on supplemental oxygen. For a 25-weeker, a NICU stay of only 82 days made us feel like he would be perfectly healthy from then on. We naively thought that the most difficult days were behind us. He was gaining weight beautifully, engaging with us, and making progress slow and steady. However, over the next couple of years, new challenges began to present themselves, from seizures to weight loss, motor delays, surgeries, and numerous admissions. At this point, we see about a dozen clinics at our children's hospital, and we've accessed services including home care, a lot of therapy, early intervention, and other community supports. We've also done extensive genetic testing, which has yet to yield answers. This causes a lot of anxiety about the unknowns of Miles's future and really complicates our day-to-day. These days, much of my life is dedicated to providing Miles with the best support possible and advocating for the best healthcare possible. But this has not been without its challenges. I am a healthcare professional myself, and I intended to return to work once Miles was old enough to attend daycare. Cue a pandemic coupled with severe chronic lung disease, which put a temporary hold on our plans. Just before he turned 2, the pandemic was waning, so we decided to enroll him part-time in a daycare where he received a one-to-one aid through a program funded for children with disabilities. Initially, this went very well until he began having focal seizures regularly and unexplained weight loss. With an NG tube placement on the horizon and the frequent calls from the daycare disrupting my workday and causing anxiety, we pulled him out of daycare. We briefly hired a caregiver, also largely subsidized through the program for children with disabilities, but we were unable to secure a caregiver for very long. We live just 15 minutes outside of Calgary. It is not rural, but it is just far enough outside city limits to significantly impact our ability to access childcare, including nannies or respite or other support. In our case, the funding for the support was available, but the actual support workers were not. Ultimately, because of this, I was forced to move into a casual position at my job, which I am fortunate was possible, so I can work weekend shifts and be a full-time caregiver for Miles during the week. Much of my days now are spent navigating supports, contacting clinics, ordering supplies, administering medication and G-tube feeds, participating in home-based intervention, and driving him to early intervention. My nights are often consumed with researching his diagnoses, searching for support options, and attempting to predict what challenges we will face next. Of course, I'm also administering night feeds, setting up his BiPAP, and watching his pulse oximeter. I often joke that going to work is my day off, which is saying something as I work in a fast-paced and challenging role. Ironically, if you met Miles, you would not immediately notice his disabilities unless he happened to be using his wheelchair that day, having a G-tube feed, or sleeping with a BiPAP mask on. It really is a testament to how significant medical complexity can be invisible to the outside observer. I can guarantee someone meeting him for the first time would have absolutely no idea how much our lives are affected by his medical concerns and all that they entail. We have been told by medical professionals that he looks better than his chart or that he looks great for a 25-weeker. I'm not exactly sure what that means, as it's not taken as a compliment. I feel it diminishes our journey and all the struggles that we face and continue to face as he grows older, rather than as an encouragement. Acquiring the best support possible has been a challenge both within the hospital and in the community. I often take photos and videos of concerns and observations. When we go to emergency, his issues are not always acknowledged and were usually initially dismissed. As I know Miles the best, I know when something is wrong, and we constantly need to advocate to be admitted. For example, he had repeated admissions for hypoxia, especially with illness. After multiple emergency room visits and admissions over the course of a year, we were finally able to advocate to have appropriate support in our home. The pain we endured to this point will forever remain with us, but we now have BiPAP and oxygen at home, standing orders for medication, and a good relationship with his medical team that ensures he can usually fight off his illnesses at home. This helped to avoid admissions, which has saved him a lot of medical trauma, family inconvenience, and healthcare dollars. In terms of community support, advocacy is the name of the game with a complex child. This takes an incredible amount of time and energy. We have managed to secure many hours of funded therapy for Miles, but the catch is that actually finding therapists often means long wait times, high turnover rates, and out-of-pocket expenses. Those challenges are made even more significant when you live outside big city limits. We've been allocated a generous number of respite hours, but only just recently acquired a respite worker after years of not having success. Imagine the trauma to a medicalized child when they're meeting a new caregiver every other month because the last one didn't stick around. It can be more difficult than it is worth at times to use the support available because in reality, things don't always work out the way you might expect. The additional cost of support can also be a barrier. Usually there's an out-of-pocket cost on top of what is covered for therapies, which can be prohibitive to utilizing all the hours offered, especially for families who've lost an income due to the need to remain home with the child. For the past 3 years, Miles has received early intervention support, which is provincially funded. This support has been a game changer for both his development and our family life. We have incredible therapist support, and he has made many gains. Additionally, his developmental support worker has become like family to us, which is incredible as we have no immediate family in the province. Next year, we plan to start Miles in grade 1 in our community school, which is our most recent source of anxiety. We recently learned that we can access an educational liaison to help facilitate the transition into grade school through the neurology department. This was a really great resource that one of his physicians set us up with, but interestingly, none of our friends in very similar situations had any idea this existed. Something we have learned over the past few years is that you have to share your concerns with nearly every medical professional you encounter because you never know which person will have the answer or the help that you're seeking. There are definite knowledge gaps in what supports exist and how support can be accessed. In fact, some of the most useful information we receive is from other parents who have gone through similar experiences and can point us in the right direction on how to navigate the system. Parent or peer support is something I've learned is crucial for medical families. Some of the best support and deepest friendships I have now are with friends I met online who also have chronically sick children. We can openly rant about how someone blocked the last accessible parking stall, inform each other about the new store selling adaptive clothing, and share the good news of an appointment where the provider listened and cared. We don't tell each other platitudes like everything happens for a reason or it could be worse, but we can actually be open and honest with each other. It might surprise you that Facebook groups are a good way for families to connect and begin lasting friendships and combat social isolation. I wish we had had formal peer support from day one in the NICU. I think we could have been helped along the way a little easier, especially in the early years, if we had someone with slightly more experience walking alongside us. I never could have imagined how important it is to have people in your life who understand because they're going through a similar experience too. Truly, no one knows what it is like to have a complex child until you do. You might be able to imagine some aspects on a surface level, but the way it consumes your day-to-day life, changes your family dynamics and your friendship dynamics, affects your professional life and your finance, and permeates your thoughts about both present and future is truly indescribable. The path to accessing support in various settings, including hospital, home, school, etc., is extremely confusing. It feels like there is no roadmap and you're just on your own trying to figure things out. For example, in our city, therapy can be done in the hospital, in community, in the school system, privately, or funded for the program through the program for children with disabilities. It's very hard to know what your child qualifies for and how to obtain the support or get the referral. Sometimes you might have to advocate extensively to obtain the support. Medical professionals don't always have the answers or knowledge on what to pursue, as this might be outside their realm of expertise. I honestly don't know if there is a clear-cut way to navigate the therapy world, but if there is, I haven't found it yet. I know this varies province to province, but I assume similar challenges exist outside of my own experience in Alberta. It's so important to understand family dynamics and what can work best for them when making therapy suggestions as well. For example, suggesting private therapy might not make sense for a family that doesn't have insurance coverage. Someone with many children or no vehicle might prefer in-home therapy. It doesn't make sense to suggest options that are not feasible for the family and can lead to feelings of guilt if they're unable to use the suggested resource. The mental burden of navigating supports, be it medical or therapeutic, can feel absolutely overwhelming. Sometimes just the worry about your child is enough to make you shut down. I wouldn't expect a specialist physician to have all the knowledge on accessing support outside of the hospital, but it is greatly appreciated when they acknowledge the difficulties, just tell us we're doing a good job, or ask us if we need help with anything. This goes such a long way and highlights the need to work collaboratively as we navigate the unknown. Having better access to peer support and streamlined resources with navigation support for medically complex caregivers could make a big impact, not only on accessing care, but on the mental health and burnout of caregivers too. Thank you for listening to our story today. I hope this gave you some insight into both the day-to-day and the longer-term challenges of parenting a medically complex child. There are many difficulties to be sure, but there are also potential solutions that could significantly reduce stress and improve the lives of many families with complex children. Acknowledging family situations and just showing you care goes a long way and is a good first step in developing a positive relationship and working towards the common goal of the best possible outcomes for the child and their family. Thank you.
Marissa, thank you so much. And just the generosity of you allowing us in and giving a picture of your family. So it affords us the opportunity to learn from you and your experience and tremendous amount of things that you are managing for your child. So we're just deeply grateful, and it's not lost on us, even how difficult it was for both you and Francine to arrange childcare and to spend an hour with us and put this on top of your already busy schedules. So we're just deeply grateful for that. Thank you so much. Karen, maybe we'll just go to the last and final slide here. We just wanted to each kind of leave you with our own message. And so I'm just going to take this opportunity to read those. So again, my area is working at a system level, trying to push boundaries of health systems, trying to push social systems, but also working with care teams. We are seeing a permeating levels of moral distress amongst care providers as well, who want to practice in a way that meets health equity and are lacking the capacity and the structures to do that. And so mine is, I envision a day where we no longer need care coordination or navigator roles, where child serving ministries work together through joint mandates and funding streams, where health equity is achieved and family and care teams are supported, and the focus is on quality of life and thriving for children and families. Francine's closing remarks and message was experiencing compassionate, coordinated, collaborative care that includes the family voice needs to be the guiding principle for all care for families with children who have a rare and complex needs. And Karen, striving for health equity starts with listening. Through hearing a family's story about raising a child with complex needs and what it means in their life, we are able to identify barriers, customize the care we provide, and weave equity into each step. And finally, Marissa, having better access to peer support, streamlined resources with navigation support for medically complex caregivers, could make a big difference on not only accessing care, but on the mental health and burnout of caregivers for the best outcomes of the child and family. So just the final slide, Karen, and we just want to say thank you. I think there are 5 minutes or so for questions. We haven't left a lot of time. I want to thank my co-presenters who are really embedded in this every day, and just their generosity of sharing experiences that highlight these issues. So thanks so much to everybody, and I'll pass it back to Naya here.
So thank you, Nadine, Karen, Francine, and Marissa for such a wonderful presentation. In a few minutes, we will be taken back to the main stage, and then there'll be a 15-minute break that will follow shortly after that. So I'm just going to say thank you to everyone for participating, and we'll see you soon.